Now to Willacy County, where a child just tested positive for COVID-19. We told you about this yesterday. It is Willacy's first and only known infection. Valerie Gonzalez with One Doctor's message to parents.
Children are largely considered carriers of the virus. The 4-year-old child in Willacy County didn't appear to have left the community. That has doctors concerned about how the child got sick and who else could have been exposed. The elderly and those with underlying conditions. Most are concerned with these populations contracting COVID-19. Children are not immune to it. A large part of those who have it are asymptomatic, and others experience it in a mild way, explains pediatrician and infectious diseases specialist Dr. Enrique Cáceres.
The other vast majority are patients who have mild symptoms, like runny nose, mild sore throat, occasional cough, but not necessarily to the point of severe distress or difficulty in breathing.
Those mild symptoms can often be overlooked by caretakers and even at the doctor's office.
We are all afraid that it may be the case that the kids have symptoms are very mild and that we don't look too much and test too much on them.
The difficulty in detecting the virus in children prompts school districts to close, counties to shelter in place, and even cities to close their playgrounds, all as a precautionary measure to protect mainly adults. According to the medical director for the region in Texas, most of the cases in the valley have affected adults between 20 through 49. The fact that Willacy County's first case was a child tells doctors the virus is more than likely present in other people.
So when a person or a child is found in the community, we're worried that probably there are many other cases circulating in adults, and they are reaching to the point that the kids are getting sick.
If parents and caretakers suspect their child is sick, Dr. Cáceres recommends they call their pediatrician office first and explain what the symptoms are before visiting the office. Most cases in children have not required hospitalization, but keeping kids from spreading the virus is essential to the well-being of the family. There is a slight silver lining in all of this. Dr. Cáceres says that 2 weeks ago, his office was busy with kids testing positive for the flu. Social distancing has inadvertently had an effect on those numbers by dropping them. In the McAllen Bureau, Valerie Gonzalez, Channel 5 News at 10.